The latest Ontario health data shows the average wait time in ERs was 20 hours before the patient got out of bed.
Canada's healthcare system is in freefall. Medical mistakes are the third leading cause of death in Canada, and the healthcare system's waits, errors, and problems have never been as bad as they are now. The average wait time last year was 28 weeks to go from seeing a doctor to getting treatment, compared to 9 weeks in 1993. That's a 200% increase in wait times. None of us want to be in a medical emergency and then have to wait hours to be seen. None of us want to be in need of life-saving surgery but wait so many months that we die. But that is what's happening every day in Canada in 2024. Canada's healthcare system is rapidly going downhill, and it's accelerating fast. People are dying as a healthcare system that used to be the envy of the world has become a horrible nightmare. More than 17,000 Canadians have died in the past 2 years while waiting for surgery. This should not be happening in a first world country or any country, but it is. In a recent poll, 68% of Canadians said healthcare has declined in the past decade, and currently 20% of Canadians have no family doctor. Canadians know how bad it is, and they want real change right away. But the Trudeau government has been ignoring the roots of the problem and making it worse through mass immigration and a bloated bureaucracy throughout the medical system. If something isn't done soon, Canadian healthcare is going to become a Cuban-level disgrace. Alarmingly, we're already reaching hints of that level of corruption, understaffing, massive wait times, incompetence, and brokenness. In this video, we're going to take an honest look at Canada's broken healthcare system and its causes. Can anything be done? Or is going to the United States or another country for serious medical needs the only option left? There are 4 main problems currently dragging the Canadian healthcare system toward collapse. 1. Understaffing and resource crunches. Many Canadian doctors are choosing to go to work in the United States and abroad instead of working for low wages in Canadian hospitals without enough resources and too much red tape. 2. Lack of access to treatment and surgery. Not a single Canadian should ever die waiting for surgery. The fact that more than 17,000 have died in the past 2 years is an unbelievable travesty and tragedy. 3. Incompetence and medical error. Far too many Canadians are dying from avoidable medical errors and diagnosis. It's become an all-out epidemic, and many Canadians are now terrified of ending up in hospital or relying on a diagnosis in case something goes wrong. 4. Rapidly growing urban populations of new immigrants overwhelming capacity. With Trudeau bringing in over 1.2 million newcomers to Canada last year, the country is crammed way over capacity, especially since the majority went to large cities that already have overcrowded hospitals. Expecting doctors to just handle more and more boatloads of random people who don't speak English is absolutely insane. Now let's look more closely at these problems affecting Canadian healthcare one by one, starting with the critical issue of lack of resources and understaffing. To say Canada's current healthcare staffing situation is bad would be an understatement. Canada's doctors are coming apart at the seams, asked to make life or death decisions between who to give a bed to and who to make wait. It's become a horrific nightmare in the ER halls as staff scramble to try to save lives without enough resources or employees.
It's not uncommon for these patients to be unstable, and you're constantly weighing these decisions, like, do I give one bed to an 80-year-old with a heart attack or a 5-year-old with an asthma attack? People don't mind hard work. This is what we signed up for. This is what we want to do. It's hopeless work is the issue. And these decisions, these resource crunches, take a toll.
The average time people have to wait from when their doctor sends them to a specialist until they get important treatment went up from around 27 weeks in 2022 to almost 28 weeks in 2023. Compared to 1993, when it was only around 9 weeks, the wait time last year was around 200% longer, and it's on track to be even worse this year. Canadian doctors are becoming increasingly concerned about its capacity to manage the situation. Emergency departments nationwide are experiencing overwhelming patient volumes, leading to prolonged wait times for care. Staff shortages in particular are putting a huge strain on the system. Dr. Trevor Jane, representing the Canadian Association of Emergency Physicians, recently described the conditions in emergency departments across the country as dire and completely unacceptable. There's a drastic need for systemic reforms to prevent further deterioration of emergency care services. Dr. Jane highlighted the the detrimental effects of overcrowding on patient outcomes, emphasizing the urgent need for solutions. With patients waiting up to 32 hours and some dying in ER, the situation is completely out of control and there just aren't enough doctors. It's very important to create a supportive work environment to retain and attract skilled personnel. Despite federal funding initiatives aimed at addressing healthcare challenges, only a few provinces have signed agreements with the government, leaving many provinces and regions grappling with unmet needs. Then we come to the related subject of lack of access to treatment and surgery. Over 17,000 Canadians passed away while awaiting surgical procedures or diagnostic scans in 2022 and 2023, with wait times ranging from less than a week to nearly 11 years. The think tank Second Street believes this figure might be considerably higher, around 31,000, but was not given information by the 12 health bodies in Canada in order to be able to officially state the full numbers. These patients who died were awaiting treatments that could have potentially saved their lives, such as heart surgeries, cancer operations, and procedures aimed at enhancing their quality of life, such as hip replacements. Even before the COVID-19 pandemic, medical delays were already getting very bad. There needs to be a massive restructuring of the healthcare system in order to prevent these kinds of delays that steal lives that could be otherwise saved. This brings us to the troubling growth in deadly medical error and misdiagnosis in Canada's healthcare system. Medical error is the third leading cause of death in Canada, with far more than 28,000 Canadians dying due to medical errors each year. Medical error ranks just behind heart disease and cancer in fatalities. Medical mishaps also inflict injuries on tens of thousands more individuals who don't die, but are scared or disabled for life. In the current healthcare system, which is overworked, understaffed, and strained by the pandemic, errors are more likely to occur. Some of the prevalent medical errors include surgical and anesthesia mistakes, insufficient post-procedural monitoring, and birth-related injuries or trauma. Delayed diagnosis and treatment, along with misdiagnosis and failure to diagnose, are among the most severe types of medical errors. There have been far too many instances where patients suffer due to delays or oversights in treatment and even have to wait in the ER waiting room after a heart attack and then pass away instead of being saved. Medication errors, often involving prescribing doctors or pharmacists who don't properly understand the illness they're facing, can have serious repercussions, especially when compounded by inconsistent care or communication gaps among short-staffed hospitals. It's crucial for individuals to be proactive advocates for their own health care, urging them to ask questions, seek informed answers, and ensure consent for procedures. In the event of a suspected medical mistake, obtaining treatment for resulting injuries is paramount. Filing a complaint with the hospital's patient relations department triggers an investigation, and regulatory bodies like the College of Physicians and Surgeons of Ontario oversee inquiries into doctors' conduct. That said, determining legal recourse for medical errors can be complex, often requiring review by legal and medical experts to assess whether the standard of care was breached. Compensation may be sought for pain and suffering, treatment expenses, lost income, and family-related losses. But even if a patient does get some compensation for what happened, it doesn't make up for the thousands of tragedies which have occurred and for the collapsing healthcare situation that is harming so many. Then we come to the mass immigration that's swamping Canada year after year and the horrific effect this is having on the healthcare system. In Canada, the Liberal Progressive government under Justin Trudeau has implemented an unprecedented legal immigration importation program, which has massively worsened the strain on the country's healthcare system. The influx of immigrants has led to a significant increase in emergency room wait times, resulting in unnecessary deaths of hundreds of Canadians, including individuals like Catherine Snow and Alison Holthoff in Nova Scotia, where immigration resettlement rates are particularly high. Conservative pundits in Canada have vocally condemned the government's immigration policy, attributing it as a major factor in the collapse of the healthcare system. Diane Francis, a columnist for the Financial Post, pointed to Prime Minister Trudeau's plan to increase immigration levels to an average of 500,000 per year by 2025 as unsustainable and detrimental to the healthcare system. Canadians are already struggling to find a place to live or rent, but with barely any healthcare left either, the majority of native-born Canadians are going to start leaving. As a result of the influx of immigrants, Canadians are experiencing prolonged wait times for elective surgeries, procedures, appointments, and tests, exacerbating the strain on an already imperfect healthcare system. Despite the evident impact of Trudeau's immigration policy on the healthcare system, there has been limited exploration or acknowledgement of just how bad it is. Trudeau's immigration plan has overwhelmed the healthcare system, leading to increased wait times and declining quality of care. Despite the existing regulations allowing the government to reject sick immigration applicants likely to strain the healthcare system right after they arrive, Trudeau's administration shows no sign of slowing down and has no apparent concern for its own citizens. In the United States, the Biden administration's policies have facilitated the entry of millions of uninsured foreign nationals at the southern border, including advanced stage pregnant women, unaccompanied minors, and families with young children requiring pediatric care. But instead of learning the lesson from our southern neighbor, Trudeau and his far-left cabinet have just doubled down on their unpopular policies and continued to hit the healthcare system hard without a second thought. As if all this wasn't enough, a growing segment of Canada's population, now over 20%, has no family doctor and often goes months without basic medical checkups. Over half of Canadians have a very difficult time getting an appointment when they need one and receiving basic medical checkups. Canada is facing a significant shortage of family doctors, with half of Canadians struggling to book timely appointments or lacking a primary care physician altogether. The survey found that 1 in 5 Canadians doesn't have a family doctor, while nearly a third of those who do face difficulties in scheduling appointments. This issue is prevalent nationwide, with varying levels of shortage across regions. The scarcity not only impacts healthcare access, but also contributes to burnout among family physicians who just have too many people desperately in need of their attention, diagnosis, and referrals to specialists. The Canadian Medical Association is exploring strategies such as simplifying licensing procedures for physicians across provinces to improve staffing challenges, particularly in rural areas, but so far the major challenges and lack of family doctors continue to plague the country. With all of these problems, it won't be long before Canada's healthcare system will be near total collapse. Canadians have had enough. Living in one of the highest tax nations in the world with rapid inflation is bad enough. Not having basic medical care has crossed to the next level of insanity. The Trudeau government and Health Minister Mark Holland are abdicating their basic responsibility to Canadians, and people are dying. This needs to change yesterday, and pressure needs to be ramped up massively across the country on this incompetent and dangerous Liberal government. If you like this video and want to learn more about what's really going on in Canada, check out this video here. And if this video brought value to you today, please consider liking, subscribing, and sharing the video. Thanks for watching.